No, and thank you very much, and thank you everybody for joining today to celebrate Jim. I first met Jim on the ESPN course as a trainee about 20 years ago, and I have to say, from the get-go, he was an absolute inspiration to all of us. He was modest, knowledgeable, funny, and was the most engaging lecturer that I've come across, and he really engaged an audience on whatever subject he was talking about. And what I did find at those ESPN courses where we did get to meet this eminent faculty was that there were depths to Jim that you've been hearing about today that were quite remarkable. And the area that drew my attention was his fascination for books and the history of neurosurgery and of medicine in general. He was a true polymath and affirmed bibliophile, and his love of the history of neurosurgery really knew no bounds. I realized how deep his love of books was when it kind of dawned on me that he, to a degree, logged bookstores around the globe that might furnish his interest. And he asked me where I was from. Said I was from Bristol. He goes, there was a great secondhand bookstore near you. And I looked quizzically and slightly blankly at him, and he said, Stella Books in up in the Wye Valley. And this is a pretty small bookstore. I think they have quite a big online presence on the Wye Valley in Tinton. And Jim had heard of it as a potential source for rare tomes. And to talk about the history of Hydrocephalus is somewhat of a challenge, given that this is a memorial for the world expert on the history of Hydrocephalus. And Jim wrote an excellent chapter in this text on pediatric hydrocephalus a few years ago. And you can see it's been very popular in downloads and so on. So I'd like to go through a bit of a history of the hydrocephalus, and the first descriptions really go back to the Hippocrates and then the Roman physicians. The Hippocrates, really the father of medicine, first described the clinical syndrome of hydrocephalus with headaches, double vision, vomiting, and he first coined the term, but explained the illness as a liquefaction of the brain due to epileptic seizures. Galen gave the first accurate description of CSF and described the foramen of Magendie, but and did hypothesize that CSF was produced by the choroid plexus. But after that, things somewhat unraveled, and he attempted a classification of fluid collections in the head, all of which he termed a type of hydrocephalus, but really only the incurable one was the one within the brain and between the meninges and the brain. And a lot of the treatments of hydrocephalus that were proposed in this Roman to medieval era were really treating subgaleal collections or epidural collections rather than true hydrocephalic states. There was a great fear of opening the skull, and the consequences of opening it were great. And really, if people did attempt to tackle this surgery, there were some Arabic physicians that discussed treating hydrocephalus through openings in the skull, but these were generally superficial rather than draining the CSF, which was invariably fatal back in those days. Da Vinci, well, he first illustrated the ventricular system and actually correctly identified the aqueduct of Sylvius before Sylvius, but was again influenced by Galen's teaching and described the blind ending fourth ventricle. And Vesalius added to this and really identified the CSF as a fluid accumulating within the ventricular description, and actually based the anatomical structure of the cerebral ventricular system on autopsy evaluation. And Vesalius published what many would regard as one of the greatest textbooks in medicine, and certainly in human anatomy, the De Humani Corporis Fabrica, and in 1543. And one of the things that never ceased to amaze me was that Jim owned a copy, I think perhaps more than one, of the book. And not only did he own a copy of the book, he owned Robert Hooke's copy of the book. And Robert Hooke was the scientist who in 1665 published a book called Micrographia, which was the first published book of microscopic examination of the world. And you may have seen this famous image of a flea, which back in those days was quite startling to the people around him. And this was the sort of microscopic equivalent of Galileo's discoveries. It was really remarkable, and it may not surprise you that Jim Goodrich also owned a copy of Micrographia. The CSF circulation, again, slowly evolved. Thomas Willis reported that CSF must flow into the venous system. Monroe then described the arachnoid granulations and the foramen of Monroe. Magendie described the fourth ventricular opening and the fact that obstruction of the ventricular pathways led to an internal hydrocephalus. And then the real breakthrough was with Kian Retzius's fantastic studies on the CSF circulation, and they really absolutely nailed how the ventricular anatomy works and how the CSF flows within it. And again, a landmark paper, and again, perhaps you won't be surprised to know that Jim Goodrich owned a copy of Kian Retzius's textbook. Dandin Blackfan, with some very elegant experiments, provided CSF formed in the ventricles by the choroid plexus, and got fairly close to identifying the correct CSF production rate, and realized that CSF was absorbed back into the bloodstream in the subarachnoid space, and also described two types of hydrocephalus, obstructive and communicating. And these, again, were further significant breakthroughs that helped develop the treatment of hydrocephalus in those days. In terms of the treatments, the treatments early on were really the realm of the physician, and Robert White in the 18th century published again a significant treatise on what he described as dropsy of the brain. I remember talking to Jim Goodrich about this paper, and he said, "Oh yes, I've got a copy of that pamphlet." And unlike me, it wasn't the photocopy from the British Library; it was the original. And in this, White does describe his attempts at treatment. And I think if you look at the bottom left, he says, "I freely own that I've never been so lucky as to cure one patient with these symptoms, and certainly denote this disease." And he suspects that anybody who successfully treated hydrocephalus was basically making it up, and they'd mistaken it for another diagnosis. He describes various treatments, including a number of purges and so on, using jalap, which is a purgative that was used in the 17th and 18th centuries. And this really goes back to Galenic times. And we can see from Robert Chisholm's thesis in 1796 that he also talked about purgative treatments, and just saying that evacuations of water either by the bowels or the kidneys are a good sign, and Celsus is certainly right when he says si plus humoris exercitur quam assumitur tunc demo fecunde validinis Cepus est, which I think roughly translates as if more bodily fluids are lost than received, then at least recovery can be hoped for. But unfortunately, in many respects, these were also unsuccessful attempts. Celsus, along with many others, was obsessed by how many pounds or quarts of fluid were found in hydrocephalic patients. And here he reports 5 quarts of limpid water in the brain. In those days, the exact constituents of CSF had not been determined. In terms of more radical attempts to deal with CSF, Lecat in France had attempted ventricular puncture with some rather alarming devices, which led Alexander Monro of Freeman Monro fame to say, if ever the operation is attempted, the opening should be made with a lancet, and at any part where there is no danger of wounding any large artery or venal sinus of the head. But all of these attempts were invariably fatal. But nevertheless, ventricular puncture did gain a little bit of a surge in popularity in the early 19th century. Here's a report from Liverpool describing some cases. Quincke reported in 1891 repeated lumbar punctures after the invention of his eponymous needle, and occasionally reported some successes for mild cases, essentially pushing them into an arrested state, which led to some very fervent clinicians really going for it in terms of the number of lumbar punctures. Frank van der Bogert reports 200 lumbar punctures of a single patient over a 4-year period, which eventually resulted in an arrested state. I still feel for the patient, though. In terms of other treatments that were tried, Brainard recommended injection of strong iodine solution to destroy the secretory epithelial lining, followed by tight head bandaging. And then, but sadly, every single case did not survive, perhaps unsurprisingly. Sommer in 1886 recommended exposure of the head to bright sunlight. Sommer was an Italian physician, but nobody was able to replicate Sommer's reports, leading to Pott from Germany in 1896 saying that possibly the masculine son of Germany is more energetic and healing than ours, who is a lady. But thinking more about the radiation, Röntgen had just developed his X-rays, and there was a vogue for treating everything with radiotherapy. And Skalitz in 1926 started irradiating hydrocephalic patients after demonstrating that radiotherapy destroyed the choroid plexus. Unfortunately, the effects on the brain were also somewhat adverse, and this unsurprisingly died as a potential therapeutic intervention. And I think Jim Goodrich summarized it nicely when he looked and did a review of Arabic medieval physician, but concluded that actually even up until really the 1930s, there was very little progress in the treatment and management of hydrocephalus. And he summarized this saying, if one looks back at the treatment, this disorder was historically primarily mostly a medical treatment, with physicians prescribing diuretics, purgatives or colonics, and in many cases the application of leeches or bleeding. And he went on to say how virtually every case resulted in fatality. So was it better to do nothing? Well, Lawrence and Coates looked at a historical series of conservatively managed infants, and 2/3 died in the first 18 months of life. 60% of survivors had learning disability, and 20% of them were blind. So again, intervention really did need to be considered, and a number of attempts before shunting came through were looked at. Carotid ligation was attempted by a number of clinicians before Walter Dandy first demonstrated that open plexectomy was a potential avenue for successfully controlling hydrocephalus, certainly in slowly progressive cases. But the early results were disappointing. Leo Davidoff, who interestingly is the eponymous name of the neurosurgery unit that Jim Goodrich worked in. Leo Davidoff was practicing predominantly in the first half of this century, and again built on the open complexectomy work of Dandy, who he trained under, and introduced a number of techniques to try and improve the outcomes, but sadly these weren't successful. And overall, with open surgical plexectomy, the results were showed that around nearly half of the patients undergoing the intervention died. Things progressed a little. Lespinasse was a urologist, but was credited with the first endoscopic choroidplexectomy, and Dandy soon followed him with an endoscopic avulsion. These techniques were refined predominantly by Tracy Putnam and John Scarfe in the 1930s, and they really dramatically reduced the mortality and improved the success rates. And here's a picture from Dandy going hog wild to remove all of the available choroid plexus, including that in the post fossa, and plexectomy became a very popular technique. There were numerous reports from Argentina, Russia, East and Western Europe, Cuba, and many other sites showing some successes. So things were gradually improving, but still not great. Overall, perhaps about half of the patients had some short-term improvements. And so we went on to third ventriculostomy. Dandy, again, influential in the development of this, but really the initial techniques were very destructive, involving destruction of the optic nerve and a relatively high mortality, but results improved, particularly in the 70s when Rees and the new wave of endoscopic technology came through. Things were much improved. But really, it was only the development of shunts that made a real big difference in hydrocephalus management. And there were a number of abortive attempts: drains into the subaponeurotic layer, drains into the longitudinal sinus and the subarachnoid space, linen threads coming into the subarachnoid, from the subarachnoid space into the temporalis fascia, drains into the lumbar subarachnoid space into the vertebral body, and a number of internal shunts for obstructive hydrocephalus. So all of these treatments were tried and were rather unsuccessful, until at last we get to the Spitz-Halter valve and a new era of hydrocephalus management developed. This was a bit of a whistle-stop tour, and but I just want to say thank you to this man for fostering a passion for the history of neurosurgery in me and in many hundreds of other neurosurgeons around the world. So thank you, Jim Goodrich.
Thank you very much, Mr. Edwards. That's taking us through the history of a condition that we treat day in, day out, but knowing how it has evolved is really good to know. And I wonder how it will evolve in the next 10, 20 or 100 years. I hope no surgery will be the best. How do you think it will evolve in the, I know it's a bit hard to, but in looking at the history and looking at the current state, how do you think hydrocephalus will evolve in the next 10, 20, 30 years?
I think we're gradually getting there. I think we're still going to rely on shunts. I think we're looking at smart valve and smart shunt technology. And there are some promising avenues of drug therapy coming through now. And so hopefully in years to come, we'll have some better therapeutic interventions. But I think it's going to be with us for the rest of our careers.